Hey everyone, welcome back to our channel, the go-to place for information and strategies on learning disabilities, especially ADHD. In this video series, we're sharing some of the potential treatments specialists can recommend for your child's ADHD. That way you know what to expect and how to go about treating ADHD. In today's video, we're just going to cover the different kinds of counseling that are effective for helping people with ADHD, why, and how to go about getting counseling. Specifically, this series covers exactly how official and authoritative resources that have actually proven their legitimacy, like the Mayo Clinic, the National Institute of Mental Health or NIMH, the Child Mind Institute, Children and Adults with Attention Deficit Hyperactivity Disorder or CHAD, WebMD, and the American Psychiatric Association recommend ADHD treatments for children and adults. These are the exact same resources Dan Kramarski, a school administrator for over 30 years and the lead instructor for our upcoming course on how to help parents handle the transition to middle school for their kids with ADHD, has used to treat his own ADHD and that of his daughter, who is now a successful university student. Now, we know most parents would be happy knowing their kids will make it through high school safely, so take Dan as an example case study and listen closely. This series covers 4 standard treatments for ADHD in children, including medications, like stimulants, other medications, and how to give medications safely. If you haven't watched our video about ADHD medications yet, click the annotation on the top right of your screen to watch that video. Behavior therapy, like social skills training and parent skills training. If you haven't watched our video about ADHD behavioral therapies yet, click the annotation on the top right of your screen to watch that video. Counseling, like psychotherapy and family therapy, which is what we'll be covering in this video. And education services, like school programs, individualized education programs or IEPs, and 504 plans, which is what we'll cover next in this series. Using these 4 treatment methods, you or your medical professional should jointly develop a treatment plan that prioritizes and addresses each problem area for your child. Now, these areas can include school challenges, self-esteem, anger management issues, co-occurring disorders such as depression or anxiety, any other learning concerns, and peer and family relationships. However, a more comprehensive treatment plan that really covers all your bases would include all or some of the following based on the unique needs of your child. Learning more about ADHD as a disorder and its causes. Learning more about diagnosing ADHD and the potential options for treatment. Hopefully we've got you covered there. Setting up behavioral therapy for your child to help manage his or her behaviors and also to acquire new skills for handling them autonomously. Understanding the differences between ADHD medications and prescriptions and how to set up regular monitoring after trying a new medication. Getting mental health counseling for you, your child, or the whole family to address things like relationships, self-esteem, discipline, and other parenting concerns. Setting up educational program modifications and supports, including 504 plans, tutoring, and special education programs. And finally, whether you should consider taking parent training classes or programs from an ADHD coach to address your child's behavior both at school and at home. An ADHD coach can also potentially help with marriage counseling, since we know that statistically, parents of kids with ADHD are twice as likely to get a divorce than other parents of neurotypical kids. Now, if you want to set up a comprehensive treatment plan like that, sign up for our upcoming course taught by Dan and other ADHD experts like psychiatrists, school psychologists, behavioral therapists, and ADHD coaches. It'll help you set up your child's personalized treatment plan, better your relationships both at school and at home, and handle the entire process of transitioning to middle school. Check out the link to the course in the description below. So, treating ADHD often requires medical, educational, behavioral, and psychological intervention. This comprehensive approach to treatment is sometimes called multimodal because it incorporates so many different modes of treatment. However, although these treatments can relieve many of the symptoms of ADHD and even improve physical coordination, they do not cure it. While there is no cure for ADHD, currently available treatments can help reduce symptoms and improve functioning. Just know that it may take some time to determine what works best for your child. Also, as both a medical and health disclaimer, I am not a doctor and this video does not provide medical or health advice. It is intended for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. Never ignore professional medical advice in seeking treatment because of something you've heard on this YouTube channel or from SmartCourse as a whole. If you think you may have a medical emergency, immediately call your doctor or dial 911. ADHD patients' symptoms vary significantly, so it is extremely important to speak with your physician or medical professional in order to come up with a tailored approach that works specifically for you and your child. That being said, and all things being clear, let's go over some of the best information out there. Now first, you're probably watching this video because you're wondering, what is the most effective ADHD treatment? Well, based on both the Child Mind Institute and the American Psychiatric Association, research shows that a combined approach of medication and behavioral therapy is the most effective treatment. For moderate to severe cases of ADHD, the first line of treatment is usually medication, more specifically ADHD medications called psychostimulants, which increase the amount of certain chemicals in the brain, help children focus, and curb impulsivity and hyperactivity. Behavioral therapies, on the other hand, help kids rein in impulsive behavior and be better organized. So again, if you haven't watched our videos on ADHD medications or behavioral therapies, please click the annotation in the top right of your screen to watch those videos. On the other hand, counseling like psychotherapy, family therapy, and other lifestyle or home remedies can still be very helpful and may be necessary for some children with coexisting conditions such as anxiety or depression. In these cases, counseling may help both ADHD and the coexisting problem. In general, to treat ADHD effectively, more than one intervention is needed. So by working closely with your healthcare providers and school personnel, you'll be able to find the treatment options that are most suited to the unique needs of your child and family. Close cooperation among therapists, doctors, teachers, and parents is therefore very important. Let's go over the different potential ADHD therapies. Children with ADHD often benefit from behavior therapy, social skills training, parent skills training, and counseling, which may be provided by a psychiatrist, psychologist, social worker, or other mental health professional. Examples of therapy include behavior therapy, in which teachers and parents can learn behavior-changing strategies such as token reward systems and timeouts for dealing with difficult situations. Social skills training, which can help children learn appropriate social behaviors. Parenting skills training, which can help parents develop ways to understand and guide their child's behavior. Psychotherapy, which allows older children with ADHD to talk about issues that bother them, explore negative behavior patterns, and learn ways to deal with their symptoms. And family therapy, which can help parents and siblings deal with the stress of living with someone who has ADHD. The best results occur when a team approach is used, with teachers, parents, therapists, and physicians working together. As a caregiver, it's important to educate yourself about ADHD and available services, and work with your child's teachers so that you can refer them to reliable sources of information that will support their efforts in the classroom. In this video, we're just going to cover the different kinds of counseling that are effective for helping people with ADHD, why they're effective, and how to go about getting counseling. First, if you're wondering why we're talking about counseling and psychotherapy when this video is about ADHD, let me explain. ADHD affects kids in many different aspects of their lives. Their inattention and impulsivity also affects their friendships, extracurricular activities, and family life. They may have trouble making and keeping friends because they interrupt constantly, talk too much or at the wrong time, or say things that are inappropriate. They may have trouble playing on teams because they find it hard to focus and follow the rules. They may have trouble understanding what's expected of them in social situations, have trouble expressing themselves, miss the point of a lot of humor, and can be prone to blowing up when they don't get their way. Sometimes young children with social awkwardness or deficits are misdiagnosed with autism because these behaviors are one component of an autism diagnosis. But it's important to recognize that these behaviors occur in a lot of kids who aren't on the spectrum too. They don't get things that seem to come effortlessly to other kids. They may have trouble understanding what's happening in a group and finding a way of fitting in. It's not uncommon for children with severe ADHD to be blacklisted from playdates because they can't be counted on to behave. At home, they may find themselves on a collision course with parents and siblings because they don't follow instruction, are impulsive, and melt down when they are asked to transition from some activity they enjoy to mealtime, homework time, or bedtime. So for children and teenagers, being just a little bit off in their social behavior can easily trigger rejection by their hyper-aware peers and make them easy targets of bullying and teasing. Additionally, kids with ADHD are often defiant or demonstrate disruptive behavior. To be clear, defiance and emotional outbursts are very common in kids with ADHD, but they are not themselves symptoms of ADHD. Kids who have ADHD tend to become defiant when they are expected to do things that are hard for them, especially when it means stopping something that's pleasurable, like playing a video game. Some things like homework, going to bed, getting dressed, and coming to dinner can become battlegrounds. These situations are difficult for them to tolerate because of inherent deficits in paying attention, tolerating a boring situation, reining in impulses, transitioning from a fun activity, and controlling their activity level. Since these situations are really challenging for them, they may try to avoid them. Unfortunately, when it comes to ADHD parenting, the avoidance strategies that these kids typically use are disruptive behavior, tantrums, arguing, defiance, and power struggles. So it's best to address these issues in the healthiest way possible early, because by the time kids with ADHD reach adolescence, their impulsivity can become dangerous. It can make them prone to car accidents, unsafe sex, and other risky behaviors. Counseling, like psychotherapy, can really help address and solve these problems, while also repairing relationship issues. So what is psychotherapy? Psychotherapy is a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. During psychotherapy, you learn about your condition and your moods, feelings, thoughts, and behaviors. Psychotherapy helps you learn how to take control of your life and respond to challenging situations with healthy coping skills. There are many types of psychotherapy, each with its own approach. The type of psychotherapy that's right for you depends on your individual situation. Psychotherapy is also known as talk therapy, counseling, psychosocial therapy, or simply therapy. And what is family therapy? Family therapy is a type of psychological counseling or psychotherapy that can help family members improve communication and resolve conflicts. Family therapy is usually provided by a psychologist, clinical social worker, or licensed therapist. These therapists have graduate or postgraduate degrees and may be credentialed by the American Association for Marriage and Family Therapy, or AAMFT. Family therapy is often short-term. It may include all family members or just those able or willing to participate, and your specific treatment plan will depend on your family situation. Family therapy sessions can teach you skills to deepen family connections and get through stressful times, even after you're done going to therapy sessions. So, why is psychotherapy used to help people with ADHD? Well, psychotherapy can be helpful in treating most mental health problems, including anxiety disorders such as obsessive compulsive disorder or OCD, phobias, panic disorder or post-traumatic stress disorder, PTSD, mood disorders such as depression or bipolar disorder, addictions such as alcoholism, drug dependence, or compulsive gambling, eating disorders such as anorexia or bulimia, personality disorders such as borderline personality disorder or dependent personality disorder, schizophrenia, and other disorders that cause detachment from reality. These are all psychotic disorders. Also, not everyone who benefits from psychotherapy is diagnosed with a mental illness. Psychotherapy can help with a number of life stresses and conflicts that can affect anyone. But more than anything, it can help with a lot of the common symptoms and the aftermath of ADHD. For example, it may help you resolve conflicts with your partner or someone else in your life, relieve anxiety or stress due to work, school, or other situations, cope with major life changes such as divorce, the death of a loved one, the loss of a job, or bullying. Learn to manage unhealthy reactions such as road rage, passive-aggressive behavior, or impulsive violence. Come to terms with an ongoing or serious mental health problem such as extreme anxiety or depression. Recover from physical or mental abuse. Cope with self-esteem problems, whether they're due to a physical or psychological cause. Sleep better, if you have trouble getting to sleep or staying asleep, like insomnia. And in some cases, psychotherapy can be as effective as medications, such as antidepressants. Also, generally, there's little risk in having psychotherapy, but because it can explore painful feelings and experiences, you may feel emotionally uncomfortable at times. However, any risks are minimized by working with a skilled therapist who can match the type and intensity of therapy with your needs. The coping skills that you learn can help you manage and conquer negative feelings and fears. So what about family therapy? Why is that helpful? Well, family and marital therapy can help you and your family improve troubled relationships with your partner, children, or other family members. Family members and spouses find better ways to handle disruptive behaviors, to encourage behavior changes, and improve interactions with the patient. You can address specific issues such as marital or financial problems, conflict between parents and children, or the impact of medications, substance abuse, or another mental illness on the entire family. It can be useful in any family situation that causes stress, grief, anger, or conflict. It can help you and your family members understand one another better and learn coping skills to bring you closer together. Your family may pursue family therapy along with other types of mental health treatment, especially if one of you has a mental illness that also requires additional therapy. For example, family therapy can help family members cope if a relative has a mental disorder like ADHD and a serious mental illness like depression. But the person who has ADHD and/or depression should continue with his or her individualized treatment plan, which may include medications, one-on-one therapy, or other treatment. Say your teenage son has depression and your family doesn't understand his depression or how best to offer support. Although you're worried about your son's well-being, conversations with your son or other family members erupt into arguments, and you feel frustrated and angry. Communication diminishes, decisions go unmade, family members avoid each other, and the rift grows wider. In a situation like that, family therapy can help you pinpoint your specific challenges and how your family is handling them. Learn new ways to interact and overcome unhealthy patterns of relating to each other, and set individual and family goals as well as ways to achieve them. The research shows that counseling can help enormously. However, to be clear, depending on your specific situation, psychotherapy alone may not be enough to ease the symptoms of a mental health condition like ADHD. You may also need medications or other treatments. Let's go over the different types of psychotherapy. There are a number of effective types of psychotherapy. Some work better than others in treating certain disorders and conditions. In many cases, therapists use a combination of techniques, and your therapist will consider your particular situation and preferences to determine which approach may be best for for you. Although many types of therapies exist, some psychotherapy techniques that have proven to be effective include cognitive behavioral therapy, or CBT, which helps you identify unhealthy negative beliefs and behaviors and replace them with healthy positive ones. Dialectical behavior therapy, which is a type of CBT that teaches behavioral skills to help you handle stress, manage your emotions, and improve your relationships with others. We cover these kinds of psychotherapy in our video about behavioral therapies, and I've linked to it in the description below. Acceptance and commitment therapy, which helps you become aware of and accept your thoughts and feelings and commit to making changes, increasing your ability to cope with and adjust to situations. Psychodynamic and psychoanalysis therapies, which focus on increasing your awareness of unconscious thoughts and behaviors, developing new insights into your motivations, and resolving conflicts. And interpersonal therapy, which focuses on addressing problems with your current relationships with other people to improve your interpersonal skills, how you relate to others, such as family, friends, and colleagues. Last is supportive psychotherapy, which reinforces your ability to cope with stress and difficult situations. So psychotherapy is offered in different formats, including individual, couple, family, or group therapy sessions, and it can be effective for all age groups. What happens during psychotherapy? For most types of psychotherapy, your therapist encourages you to talk about your thoughts and feelings and what's troubling you. Don't worry if you find it hard to open up about your feelings. Your therapist can help you gain more confidence and comfort as time goes on. Because psychotherapy sometimes involves intense emotional discussions, you may find yourself crying, upset, or even having an angry outburst during a session. Some people may feel physically exhausted after a session. Your therapist is there to help you cope with those feelings and emotions. Your therapist may ask you to do homework or activities or practices that build on what you learned during your regular therapy sessions. Over time, discussing your concerns can help improve your mood, change the way you think and feel about yourself, and improve your ability to cope with problems. Now, if you're interested in trying psychotherapy and/or family therapy for you or your child, here's how you prepare. First, find a therapist. Get a referral from a doctor, health insurance plan, friend, or other trusted source. Many employers offer counseling services or referrals through employee assistance programs, or EAPs. Or you can find a therapist on your own, for instance by looking for a professional association on the internet. Next, check qualifications. Before seeing a psychotherapist, check his or her background, education, certification, and licensing. Psychotherapist is a general term rather than a job title or indication of education, training, or licensure. Trained psychotherapists have a number of different job titles, depending on their education and role. Most have a master's or doctoral degree with specific training in psychological counseling. Medical doctors who specialize in mental health, psychiatrists, can help prescribe medications as well as provide psychotherapy. Examples of psychotherapists include psychiatrists, psychologists, licensed professional counselors, licensed social workers, licensed marriage and family therapists, psychiatric nurses, or other licensed professionals with mental health training. Make sure that the therapist you choose meets state certification and licensing requirements for his or her particular discipline. Here are some factors to consider and questions to ask. The first thing you want to consider is education and experience. What is your educational training and background? Are you licensed by the state? Are you accredited by the AAMFT or other professional organization? Do you have specialty training in family psychotherapy? What is your experience with my family's type of problem? The next you want to check for is location and availability. Where is your office? What are your office hours? Are you available in case of an emergency? You also want to consider the length and number of sessions. Probably wondering, how long does psychotherapy last, or how long should my child be treated? Well, the number of psychotherapy sessions you need, as well as how frequently you need to see your therapist, depends on many different factors. Your particular mental illness or situation, the severity of your symptoms, how long you've had symptoms or have been dealing with your situation, how quickly you make progress, how much stress you're experiencing, how much your mental health concerns interfere with day-to-day life, how much support you receive from your family members or others, as well as the cost and insurance limitations. Now, it may take only weeks to help you cope with a short-term situation, or treatment may last a year or much longer if you have a long-term mental illness or other long-term concerns. You can ask your therapist, based on my situation, how long is each session? How often are sessions scheduled? How many sessions should I expect to have? You want to get a good understanding of the costs. If you have health insurance, find out what coverage it offers for psychotherapy. Some health plans cover only a certain number of psychotherapy sessions a year. Also, talk to your therapist about fees and payment options. You can ask things like, how much do you charge for each session? Are your services covered by my health insurance plan? Will I need to pay the full fee up front? and what is your policy on canceled sessions. Then review your concerns. Before your first appointment, think about what issues you'd like to work on. While you also can sort this out with your therapist, having some sense in advance may provide a good starting point. Consider whether your therapist would be a good fit for you or your family. The key is to find a skilled therapist who can match the type and intensity of therapy with your needs. To get the most out of psychotherapy and help make it a success, you should make sure you feel comfortable with your therapist. If you don't, look for another therapist with whom you feel more at ease. Approach therapy as a partnership. Therapy is most effective when you're an active participant and share in decision making. Make sure you and your therapist agree about the major issues and how to tackle them. Together, you can set goals and measure progress over time. Be open and honest. Success depends on willingness to share your thoughts, feelings, and experiences, and to consider new insights, ideas, and ways of doing things. If you're reluctant to talk about certain issues because of painful emotions, embarrassment, or fears about your therapist's reaction, let your therapist know that. Stick to your treatment plan. If you feel down or lack motivation, it may be tempting to skip psychotherapy sessions. Doing so can disrupt your progress, so try to attend all sessions and to give some thought to what you want to discuss. Don't expect instant results. Working on emotional issues can be painful and may require hard work. You may need several sessions before you begin to see improvement. Do your homework between sessions. If your therapist asks you to document your thoughts in a journal and do other activities outside of your therapy sessions, follow through. These homework assignments can help you apply what you've learned in the therapy sessions to your life. Now, if psychotherapy isn't helping, talk to your therapist. If you don't feel that you're benefiting from therapy after several sessions, talk to your therapist about it. You and your therapist may decide to make some changes or try a different approach that may be more effective. Now, some parents worry about confidentiality. Except in rare and specific circumstances, conversations with your therapist are completely confidential. However, a therapist may break confidentiality if there is an immediate threat to safety, yours or someone else's, or when required by state or federal law to report concerns to authorities. Your therapist can answer questions about confidentiality. All in all, psychotherapy may not cure your condition or make an unpleasant situation go away, but it can give you the power to cope in a healthy way and to feel better about yourself and your life. Family therapy doesn't automatically solve family conflicts or make an unpleasant situation go away, but it can help you and your family members understand one another better, and it can provide skills to cope with challenging situations in a more effective way. It may also help the family achieve a sense of togetherness. So now you know what to expect from specialists in regards to ADHD treatment with counseling, like psychotherapy and family therapy. But remember that there are many other ways of treating ADHD. We've prepared some special offers for you at the end of this video. But first, to make sure you're as prepared as you can be, I want you to hit the notification bell below, because in the next video, we'll cover the different education services like school programs, individualized education programs or IEPs, and 504 plans, as explained by the Mayo Clinic, the National Institute of Mental Health or NIMH, the Child Mind Institute, Children and Adults with Attention Deficit Hyperactivity Disorder or CHADD, WebMD, and the American Psychiatric Association. So again, hit the notification bell below and the subscribe button under this video if you want to be notified when we publish that video. Now, if you like this video, please don't forget to like it and let us know what you liked or what you'd like to see more of in the comments below. The more people like, subscribe, click the bell, and comment, the more people will see this kind of content on YouTube, and we know some people could really use the help. Now, for our special offers, you can join our expert vetted newsletter. It'll be free until January 2020, so don't wait up. Our resources will help you find answers to your basic questions about ADHD, understand why middle school is so challenging for students with ADHD, and introduce you to ADHD support groups and other sites to help you meet your child's needs both at school and at home. Visit the links in the description and on your screen. Now, if your child is being treated for ADHD, support groups can help parents and families connect with others who have similar problems and concerns. Groups often discuss regularly to share frustrations and successes, or exchange information about recommended specialists and strategies, and talk with other ADHD experts. So you can join our own expert-moderated ADHD education and support group for parents, where you can get direct help from other parents and experts with shared experiences. I put the link in the description and on your screen. While you're waiting for our next video, make sure to check out these two videos right here. We share tons of expert vetted resources on parenting and education for differently abled kids, just like kids with ADHD. So make sure to check out these two videos as well. As always, I appreciate you taking the time. Thank you for watching, and see you next week.